My name is Bob Schultz, and I am the co-founder of Direct Allergy and also its CEO. We founded the company in 2013. There are three of us, and we're now in almost our 14th year, I guess. What led to it was a recognition that allergies really are not being treated quite like they should be. In other words, the gold standard for treating allergies is allergen immunotherapy. That is the gold standard. It's the only curative approach that is being done. It's over 100-year-old modality conducted by allergists. And we have great respect for allergists that do this. And unfortunately, only 10% of the United States benefits from the gold standard, which means physicians aren't really referring patients over to the allergist like they used to. And that's a real problem. It's a real concern. And that's because there's so many other choices for treating allergies. That's called the pill. And there's a lot of pills out there. And unfortunately, that's because there's a mindset the consumer and even physicians don't realize how serious allergies are. They're considered almost like a nuisance illness when they're compromising. There's a quality of life. They're very serious, and they lead to what is known as allergic asthma for about 8% of the population. Asthma attacks about 30 million people in this country, and therefore asthma can go not only misdiagnosed but undiagnosed, right? And I'm talking allergic asthma. So about 70% of all asthma patients have allergies. That's right, 70%. So as a result, patients are looking for that quick fix. They don't realize how serious allergies are compromising. That's called breathing disorders, respiratory disorders. And they don't really know. The average patient doesn't know if it's a cold, a flu, a virus, or an allergy. They're a do-it-yourselfer. They just self-diagnose and then self-treat, and they go to their local pharmacy without any help or any guidance, and they pick their favorite flavor of the day, whether it's Claritin or Zyrtec or Flonase, whether it's a nasal inhaler or an antihistamine, and they hope that that pill is going to help them. Now, a pill by the FDA doesn't mean that it's going to work all the time, right? It might work 50% of the time and not work 50% of the time. It also is a Band-Aid. It addresses the symptoms, but not the physiological defects, the underlying cause. The average patient doesn't know that. They don't know that it's not addressing their physiological defects because they're not even having a conversation with their primary care doctor, let alone an allergist. And that's what led to Direct Allergy. We need to stop that ridiculous method of treating allergies. There needs to be an outreach to the average patient and get them to their primary care doctor where they can have a proper screening again. So there needs to be a physician consult, patient to physician, and Direct Allergy goes direct to that consumer by way of the primary care. Hence the name Direct Allergy. And we intercede by way of a contract with the primary care networks. We become the liaison, and we work on behalf of primary care doctors. We intercede and we rescue that situation by way of a contract. And with the help of telemedicine and the ownership of the physician primary care networks that own the patient panels, that dialogue can now happen. That intervention can now happen. And that's what led to the Direct Allergy model. Now Direct Allergy can provide that dialogue to qualify patients that meet the qualifications for screening. And then if they're screened and qualify for allergy testing, then they're brought into that primary care's office for proper testing. And then if they qualify for treatment, then they are brought in for, then they are introduced to allergen immunotherapy. And then they're brought in and they're given the options of allergen immunotherapy injections or immunotherapy sublingual drops where they can just take it from home every day. Or we have the new allergen immunotherapy toothpaste. That's right, you brush your teeth, you get your medicine. So there's 3 treatment options, for the patient by way of Direct Allergy's program.
Yeah, I'm Dr. Jay Gruhlkey, board certified family physician, been in practice about 20 years. And early on in my career, was lucky enough to work with ENT allergists who taught me a lot about allergy and really kind of brought me into the allergy field by showing me how it could help my patients and help my practice. And so been doing allergy for about 16 years, been involved with the Pan American Allergy as well as the National Procedures Institute on their training programs, and continue to teach classes for the National Procedures Institute, past president of the Pan American Allergy Society, and really in my solo practice have grown the allergy component to be a significant part while training other doctors how to do it. And in part of my training, I was realizing that practices were having a challenging time going back and integrating that into their practice, and looking for some options to help that out, and had some connections with industry that introduced me to Bob Schultz, and we got together and got to discussing some ways that we could bridge that gap between providers wanting to provide the allergy services and actually implementing it into their practice. And we made a connection and sat down, and that's kind of how Direct Allergy was born.
I was first introduced to the healthcare industry after I spent 5 years, almost 5 years, with Ford Motor Company. I was actually hired in from Penn State to Ford College graduate program. It's kind of an elite program for high potential talent at Ford Motor Company in sales and marketing. So that was my background, and I was fortunate enough to have 5 promotions at Ford in that commercial background of automotive industry, and those skills were transferable. So after I think a good career with Ford, which I still love and have great relationships that I maintain to this day with Ford Motor Company, I had a family tragedy that caused me to make a decision to go back to my hometown, and I transferred those skills into the healthcare industry by way of Johnson & Johnson. I actually was fortunate enough to be hired by a guy by the name of Alex Skorsky, that's now the chairman of the board of Johnson & Johnson. He was my district manager, and he hired me in and introduced me to the pharmaceutical industry. And so I was lucky to have one of the greatest mentors of all time. I got introduced to allergy at that time. We launched a drug called Hismanol. So it was one of the best once-a-day antihistamines ever that competed with a drug called Seldane. And then at that point in time, I had a nice career with J&J, about 5 years, and then I was promoted to the state of Maine, and I got into the neuroscience field. I was a trainer and neuroscience specialty rep, and then I advanced my career with a competing company called Eli Lilly, and had a nice run with Lilly. I became a national, performer at the highest level of Eli Lilly, and I got promoted into their management development program, corporate management associate program, high potential talent. And I did rotations in management development there, managed care and training and development and marketing support, etc. So I did commercial work there, and then I worked on the data side of the business of pharmaceuticals. So I got to punch my ticket in data analytics, and then I actually got into the startup world of pharmaceuticals and worked for a company for 8 years where I was a district and regional manager. And fortunately, I was able to be named National Manager of the Year 4 times with a company there. And the owner, co-founder of that startup pharmaceutical company, actually backed me when I started when I started Direct Allergy. His vice president of operations joined me as being our co-founder at Direct Allergy. His name is Joe Sajak. He became our operations vice president. And Joe's one of the finest people I've ever met, but also one of the smartest guys. He's a Princeton guy. He was a guy that was at Wolters Kluwer, IMS Inc., and he was, one of Stefan Eigner's from Reliant Pharmaceutical, one of his right-hand people. And Reliant Pharmaceuticals co-founder that backed me at Direct Allergy, and Joe joining me, we went out and got introduced by way of one of the top manufacturers in allergy. It was Antigen Labs. Vice president over there was a guy named Bob Pomranke. He liked our pharmaceutical executive team, and he helped us see this need, to build a company that today is Direct Allergy. And they were actually considering joining us, but they got bought by Greer Labs, so they couldn't do it. But Bob joined us as a consultant after he got bought out, and helped us actually form and develop design. So you might say Direct Allergy was co-designed by Antigen Labs. Their vice president of marketing was a huge contributor to our design, and we went on and did it ourselves. But with consultant help from Antigen Labs, they're national trainers from Antigen Labs. Mark Thomas and Pam Lowry joined us, and that's the start of Direct Allergy's beginnings. And then we built around it and built an extension team of great vendors, and we had an outsourced vendor team that was second to none. And we went out there and beta tested our business model in 7 states, 52 sites. And I think to this day we have the very best platform that has ever been built. And we did it under tough circumstances with regulatory threats, USP 797, that could have shut down any startup company, but it didn't shut us down. And then we had another threat called the global pandemic, COVID, and it didn't shut us down. And we're debt free to this day, but we're kind of reformulating the platform, and we're looking to make an exit, and that's kind of where we're at today.
I'm the Chief Medical Officer of Direct Allergy, and as I mentioned earlier, was lucky enough early in my career to work with an ENT allergist who showed me the benefit of allergy, and then expanding that to my private practice and being able to teach physicians throughout the country allergy testing and treatment following the ENT methodology, and being able to expand that not to only direct training, but then Direct Allergy, being able to integrate that into other providers' office to make it easier for them to implement the service, both helping their patients and the practices, serve on making protocols for the allergy testing and treatment, monitoring the training, and being involved with quality control with our clients and making sure that our staff is trained appropriately in allergy testing and treatment.
Just meeting this great guy named Dr. Jay Gruhlkey. He was the president of Pan American Allergy Society. He was a thought leader for, I think, 2 or 3 of the top allergy manufacturers. He did the allergy videos, patient videos for ALK, the #1 allergy manufacturer. So boy, was he really thought well of. Now, the Pan American Allergy Society was one of the oldest primary care allergy societies. These are for primary care doctors that did allergen immunotherapy. Well, let's see, in the Southwest, that's very prominent for primary care doctors to do allergy, not so much in the Northeast. But it's a 50-year-old society. It doesn't exist anymore, and that's because a shift has happened in our country where, physicians used to be pretty much solo. There's been a huge, shift where physicians work for themselves, right? They were primary care doctors that were solo practitioners, had their own practices, worked for themselves, group practices, IPOs, GPOs, etc. But today, most of these physicians are now employees just due to regulatory changes, cost of malpractice insurance. And there's just been a huge shift. So now healthcare systems now employ most all doctors. So as a result, the society doesn't have much of a membership, so that is now no longer. But I think was one of the last serving presidents of that, at one time, a very large society. But 51,000 or more primary care doctors in this country are doing allergen immunotherapy for themselves, or did at one time. So it was a really big movement. Of course, that has kind of changed due to the landscape. There used to be about 10,000 allergists in this country, but now there's about 6,000. So the allergists, as a specialty have diminished, although the larger cities still have quite a few traditional allergists, the Quad AI. The AOA ENTs are doing allergy, but only about 15% of them, about maybe 2,500. So there's still a big gap of allergy specialists out there. The biggest opportunity is still in that primary care market. And about 80% patients or consumers, I should say, in this country are getting their allergy solution by way of the retail pharmacy, which means they're self-diagnosing, self-treating. So the specialists, unfortunately, are not getting referrals. They're just not. They're not getting the majority of the business, the opportunity. Really, the majority of the business is still going to the retailers. And that means there's a gap in the system. There's a gap that that is happening. And that's why there needs to be a better solution. And Direct Allergy is now reformulating its platform to help the allergy specialists. Our goal now is still primary care focused, but primary care by way of the large healthcare systems support the allergy specialists within those systems to be the liaison between the primary care and the allergy specialist, to be a liaison to the primary care, to facilitate to the allergy specialist a satellite solution so that these patients that are making a beeline to the retailer is now being screened so that we rescue them to see if they qualify for allergy testing, which is what the allergy specialist would want. We would want the allergy specialist to provide direction and protocol, and then Direct Allergy would then report to the allergy specialists within these healthcare systems. But again, it would be a gap between primary care and allergy specialists that Direct Allergy would facilitate.
I think going back and looking, when I was doing all of the training with the Pan American Allergy Society and the National Procedures Institute, and really looking back at the percentage of providers that would actually take the class and then go back and implement it into their office after 1 year. And that was, less than 50% of those practices and probably closer to 30% of those physicians doing it. So there was this big gap between me training the providers and actually going back and doing it in their office. And realizing that after I met with Bob Schultz that, there could be a way that we could integrate this into the offices much more seamlessly, faster, being able to provide the training and the education, the support so these providers could add this service to their practice without them having to start from scratch. And I think that's when I really realized that, this was a good idea that we could, put into play with the right people. So we provide two-phase testing, which involves a process called MQT, or Modified Quantitative Technique, where we do both prick testing or scratch testing and intradermal testing for a more comprehensive evaluation, a more sensitive evaluation, to be able to really drill down on patients' allergies. And so really an advanced form of allergy testing with the MQT, and then being able to provide different treatment services such as the slit therapy, which is the sublingual therapy, the injection therapy, and also the oral toothpaste immunotherapy. So providing high level, high sensitive testing along with multiple treatment options, I think sets us apart from other providers who are doing allergy testing and treatment.
Patients, today there's over, as you know, about 330 million people in the United States, and there's about 100 million patients that suffer chronic allergies, but not everybody is actually seeking allergen immunotherapy. About 80% of them are really self-treaters. They're seeking their remedy by way of the retail pharmacy. And unfortunately, it's allergen immunotherapy that's holistic, and it's the curative approach. It's the gold standard, and only about 10% of the time is that really being utilized. So the gold standard it doesn't need to be used all the time, but it definitely is underutilized, and that's because the screening is not really taking place. So a patient today that's suffering from allergies is really becoming a self-diagnoser, therefore a self-treater. And they're not even going to their primary care doctor anymore. So they're missing the whole screening process. And as a result, they don't even know if it's a cold, a flu, a virus, or an allergy. And that's a problem. That's a gap in the system. And what Direct Allergy does, it really takes the bull by the horns, and it approaches the system. What we do is we'll go to the large healthcare systems, and we'll identify, we'll make this known that this gap exists, and we'll suggest that we put in a solution, which is a satellite solution where we implement an allergy center, basically strategically within their system at the front line of medicine, so that you can appropriately and strategically align where patients exist and where these patient panels are, so that they can quickly be identified and provide speed of service. So basically, we're inserting, to plug and play, an allergy center within a primary care network. If there's 100,000 patients within a region, there might be 7 allergy centers that are inserted for quality of care and speed of care. And it would be a direct allergy center that is managed but supervised by the client physician, but it would be basically furnished but with direct allergy staff, and it would be managed every day by direct allergy personnel that's fully trained. And that direct allergy personnel would handle both all the clinical activity and all the administrative activity, but report right in to the client supervising physician. So now you have these patients that are coming in, in the acute setting and getting properly identified. And if they qualify for allergy, they're getting screened and tested, and they're getting taken care of quickly without having to go outside the system. That also brings in internal revenue, for the system. But more importantly, these patients are not getting missed. They're getting taken care of. And we also have an outreach component for those patients that are not coming in and being identified. Then there's a telemedicine component that is being managed by clinical personnel that contacts the patients on behalf of the physician, and they are spoken to, and there's a survey that's being conducted to see if those patients that have an allergic history, if they're suffering from allergic rhinitis, if they would want to come in and be tested. And if they do qualify for the testing, then they're brought in. It's just another way of making sure that they don't fall through the cracks. So it's a really good way of making sure that the system is not missing these patients due to the retail craze right now that's going on.
I think certainly in the early days, building the infrastructure kind of from the ground up required a lot of resources and a lot of time, and then acquiring funding to be able to execute that, I think were probably two of the biggest challenges we had in the beginning.
It's the integration of taking our personnel and then integrating it into a client's home and into their place of business. That's not an easy proposition. You've got to make sure that that is seamless, and that's something that takes a lot of preparation and planning and execution. We had to do that with not just one type of model. There's 4 or 5 different customer types that are out there. There's group practices, there's rural practices, there's hospital systems, and we made sure that we got every one of those customer types that we practiced with. The solo practitioner, we tested those processes so that the integration did work. That was really a good thing that we did do. We also got we got faced with some regulatory challenges out there. One was called USP 797, and that means you have to be very compliant. And one thing about our model is that we're extremely compliant, and we follow USP 797 and all regulatory compliant guidelines. And then the COVID pandemic hit, and we had those kind of challenges that were out there as well. And we got through all of that through all of our beta testing. Those were some of the challenges that we had to overcome.
I think the type of allergy testing that we do, again, called MQT or modified quantitative technique, involves both the skin prick testing and intradermal testing, which has a high sensitivity that I don't think there's any other company on the market providing the 2-stage test like we do. And then the treatment options available, the standard allergy shots, the sublingual therapy, which is becoming more prevalent in the United States, and then the even newer toothpaste or omit oral mucosal immunotherapy. I think having that 2-stage highly sensitive testing and then the 3 treatment options really kind of put direct allergy in the spotlight when it comes to testing and treatment options for allergy services.
The testing to be more specific so that you can get the dosing to a much higher, starting dose, more of a higher therapeutic starting dose than normal. So we think that's a great way to start a patient out. So yes, we think that puts us in a different category than any other company that's out there that's doing remote practice of allergy.
I think, with the allergy, it's a largely symptomatic disease. So patients, have a lot of symptoms. They want to be seen. They want to be treated, as opposed to maybe diabetes or hypertension, which may have less symptoms associated with them. And so, we see cases, especially in the pediatric population, where you have student athletes, either soccer players or football players, have significant grass allergies to the point where, they're not able to do the sports that they want to go do. They're able to come in, get tested, get on treatment, and be able to go back out and enjoy those and be successful. And I think those are the stories where you really make a difference in some of these kids' lives, plus decreasing their chance for progressing to asthma or even other more significant diseases. So we see that all the time in the allergy field, really getting some of these younger patients treated early on so that their quality of life is good going forward. With our training and training of our staff, so we train the nurses that will be providing the allergy services in the practice, and they go through a formal training process to make sure that they meet all the qualifications that we expect. And then all of that information is QC'd on an ongoing basis by our clinical and our business team to make sure that there's checks and balances with all the processes that we do to make sure the patients are getting the accurate treatment, plus the business side of the practice is performing as it should.
Number one is, we have definitely built a foundation of trust between, the three of us, 100%. We operate, with a very high code of conduct and integrity, no question about that. But we certainly have communicated a clear, a clear, compelling vision of, what we expect, in terms of the organization and what our mission statement is and how we're going to get there. And we've always fostered a positive, and inclusive culture. And when we hire, I think we hire right. We hire the right people for the right positions. And we've established, just really good core values in open communication and respect. And, we really foster an environment of accountability and collaboration and teamwork, from day one, and we work our plan, but we check our work. And I think that's what's allowed us to really get through some really tough times. Most startups fail in 3 years, and we've made it through some very difficult times, and we're 10 years into it, post 10 years into it, and we're debt free. We're trying to transition here by taking our platform really to the largest customer there is, because there's been a shift in the market. Basically there was, when we got started, about 50% of the customers were autonomous. They work for themselves, or they were independent physicians or group practices. And today about 80-90% of them are employees working for large systems. So our customer has shifted. And now, the customer is the large healthcare system. That's where we have to go. And right now we're taking our platform currently today to speaking to the largest healthcare systems who could actually monetize this platform within their own system, because they're so large, and they can also monetize it outside their system. And that's kind of where we are today, to see if we can make that transition.
Staying persistent as co-founders and letting everybody on the team play to their strengths. I think, we've all done a really good job of allowing that to happen. Everybody has unique skill sets, and we've kind of created a dynamic where we're able to utilize those skill sets and be able to really function as kind of one unit.
I think Jay kind of mentioned that we really want to make sure that we find the right people that really are experts within their subject area, and then that they really stay in their lane and they lead that area. And we've got Jay, who is without question the best at what he does in terms of being a clinician in the area of primary care medicine, and at the same time being a subspecialist in allergy. And he speaks the language of primary care extremely well, and to be able to educate and provide that confidence to primary care that they can. This is allergy immunotherapy testing and treatment is within their scope, and they really need to be trained, and they should be doing that. And he's the right guy to do it and lead. And he oversees the training and development of all of our nurses and all of our trainers. It's so important. So we've isolated Jay to oversee all that, and then to have Joe that really has a stellar background in operations management in the pharmaceutical industry. And I've worked with Joe, and for Joe to be able to have that strong data analytics and finance and control background, that working knowledge in that space works very well with me when we plan out, just where we're going to go in terms of executing the sales and marketing plan. And then, of course, when it comes to the ops of the model itself, I'm a working CEO, so that's pretty much I'm kind of a COO/CEO, wearing a lot of hats in the startup, and my feet are on the ground. So I'm working, really trying to brand our company at the same time, and also raising money. And so we've got a lot of outsourcing CFO role. We have people in bookkeeping and legal, etc. And we built quite a Rolodex of our org structures, all outsourced, and that's pretty normal for startups, but ours is really solid. And then we also, we had a really tight relationship with Penn State University, and we aligned with students that created internal administrative roles for us, which helped us with our overhead in terms of costs. So we hired multiple students for part-time work, which was a win-win situation, but they were very talented in both finance and accounting and marketing and digital marketing, and that also served us very, very well, on top of having our Rolodex of outsources vendors. So we had about 16 vendors, in our structure. So we had also some independents that worked for us. So it was a myriad. As a startup, you had a variety of teams, with a startup. But I think we did a nice job of keeping everybody on one page and organized, and I think it worked. To be able to accomplish raising the capital that was necessary to, there's a huge burn rate of people and manpower to pull off proof of concept in multiple states. And the overhead was not cheap. To be able to raise that money and execute and to operate in 7 states and to be able to show that proof of concept remotely, I think was a big deal. And then to go ahead and see the shift of the marketplace going towards the larger healthcare systems, to then during COVID, instead of closing down, to optimize our resources and then sign a smaller IPO to simulate a system model called hub and spoke during that COVID period, and then successfully show operational success with very little funding, was also very successful. Again, it's showing proof of concept. Now it's important to go and, to show enormous revenue. But the only way you do that is to secure a large account. And we did that also. That would be the second one. We went and signed a very large independent physician organization account that was a multi-million-dollar account. Should help us sign larger money. Once you get that large purchase order, usually money follows money, they say at that point in time. But the market, unfortunately, we had an offer for funding, which was substantial, but unfortunately that fell through. And that's why we are in the position we're in now. We're still debt free, but we're trying to transition to save the company. And that's where we're at right now. Right now, we're kind of in a 90-day mode. We are focused on having communication with we're targeting some of the larger healthcare systems in the country. And, our goal is to convince one of them to partner with us in some fashion. And that would be to obtain or acquire us in some fashion, where they can monetize our platform immediately, because they have the large patient panel to do so, and that would mean that they would absorb our resources, and that would be something that I think would get the attention, the outside investor market for sure. But I don't think they would need the outside investor market, because they would have the internal funding to self-fund and further invest in the model. and then therefore they would have the ability to take direct allergy to the internal market, meaning not just monetize it internally in their large system, but actually have an external business revenue stream for them. So that's kind of where we think the best shot for our platform.
We know allergy is not going to go away, so it's going to be here. I think you're going to see probably more advanced opportunities for treatments coming out there that will be more readily available. But then I think you'll see an expansion of primary care, pulmonary, ENT, pediatrics being able to provide those services due to just the limited resources we have with traditional allergists and the demand of the patient population. I think will really drive this expansion into to other healthcare markets. Nothing's going to happen fast, but be persistent. So have patience and persistence. But just be patient and keep working for the goal, and you'll get there.
I would say if there's anything that advice from the start, probably try to secure even more funding before the startup. But you know what? It's easier said than done, but that's probably what I'd probably try to do.